second plane, that's the first plane, which is deep. Then the second plane, which is superficial, we're now going to suture now the skin. And the suturing of the skin, generally I like doing it into the suturing of the skin. You need to know that what to suture the skin, you need to evaluate for the infectious rate. There are three elements when you want to suture the skin. You need to evaluate for 1, the infection rate. You need to evaluate for 2, the cosmetics. And you need to evaluate for 3, the tensile strength. Those are the 3 elements that make you suture the skin. When you want to suture the skin and the superficial areas above the superficial fascias, you should think of these 3 major elements. You think of the infection rate, you think of the cosmetics, and then you think of the tensile strength. So, provided that is a place where there is a high infection rate, there is a high normal flora, so you need to do simple intermittent. You do intermittent sutures. If there is a high infectious rate, high normal flora in that area, with high infection rate, you do simple intermittent. Now, provided that you are in a place where there is a low infection rate, I want to consider the cosmetics, like at the level of the skin. You want to consider cosmetics. You can now do simple continuous. So provided there is no infection rate, you want to consider cosmetic, you want to privilege cosmetic best, you do simple continuous. Now, provided that now you are in a case of a trauma, in a case of a trauma, or you're in a location where there is high pressure, like at the level of the abdomen, when there is a level of the abdomen or level of the fascias of the muscles, you're now going to do vertical. It's still intermittent, but it's a special intermittent called the vertical mattress. You do a vertical mattress. So that is how these are different suturing types that you can use at the different locations of the skin when you are involved. So those are the different elements that you need to take in consideration when you want to suture. Now, stage 3 is when there is involvement of the stage 3 perineal tear is when there is involvement of the stage 3 perineal tear is when the involvement of the anal sphincter. Stage 3 is when there is involvement of the anal sphincter. Now, in the involvement of the anal sphincter, in stage 3 there is involvement of the anal sphincter, and when there is involvement of the anal sphincter, it is divided into stage 3A, B, and C. When there is less than 50% involvement of external anal sphincter, it is stage 3A. When there is more than 50% involvement of the external anal sphincter only, it is stage 3B. And when there is both involvement of the external anal sphincter and the internal anal sphincter, it is stage 3C. Now, the stage 4 is when you have involvement of the anal mucosa. Is when there is a perineal tear and involvement of the anal mucosa is stage 4. Is it clear? So those are the different elements that you need to evaluate. So now the next thing is to know now the risk factors of the perineal tears. What are the elements that has resulted to this perineal tears? The perineal tear can be related to the fetal, can be related to maternal, and it can be related to iatrogenic. So those are the risk factors of perineal tear. The fetal risk factor of perineal tear, we can have a large size fetus like fetal macrosomia. If you have fetal macrosomia, if you have things like shoulder dislocation, malpresentation, shoulder dislocation, if you have full shoulder dystocia, if you have malpresentations, malpresentation, if you have malpresentations, if you have small fetus, generally also small fetus is going to result to perineal tear by mechanism of precipitated labor. Now, maternal, if you have the things like prolonged labor can be the case of malpresentation, macrosomia, and shoulder dislocation is going to result to that. Second one, you have precipitated labor. If somebody goes like in a ballistic fashion, when there's a very fast movement, it can result to tear. Is it clear? So because of a high impulse, when something passes very suddenly, the time is very small, and then the force, though the force is small, the time is small, it makes now the impulse. So if the time is small, it makes the impact to be high. Is it clear? So those are the different things that you have to involve. So provided that normally to reduce the shock, the time, when there's a time, a very high time, the shock can be reduced. But provided the time is very small and then a small force pass on it, it can result to a very huge injury. So that's precipitated labor. Yeah, and precipitated labor is when second stage of labor occurring when labor occur less than 2 hours. If you have labor occurring when less than 2 hours, it's precipitated labor. Is it clear? Now, the next one, the third one now is going to be after precipitated labor. We have the next one, which is going to be the after precipitated labor. We have also for the mother, we have the perineal diameters, small perineal diameters. Is it clear? So which is called the anoperineal diameter. So when you want to measure if the anoperineal diameter, the diameter between the anus and the anterior side of the anterior fourchette of the vagina is less than 5 centimeters, generally it's a risk factor of perineal tear. That's the anal fourchette or the anoperineal diameter. Is it clear? That's for the mother. Is it clear? You can have other things like obesity of the mother. Is it clear? So those are the different risk factors for perineal tear. Now, the iatrogenic risk factors of perineal tear. What are the different iatrogenic risk factors of perineal tear? We have one, poor conduction of the second stage of labor. When there is a poor conduction in the second stage of labor, is iatrogenic. Is it clear? And then the second one, so when there is usually poor conduction in the second stage of labor, we have also instrumental deliveries can result to perineal tear. Is it clear? So those are the different risk factors. Now, the next thing which is also important to speak about in perineal tear is also going to be the complication of perineal tear. Is it clear? What are the complications of perineal tear? Now, for the complications of perineal tear, you need to know that it's divided into early and late. Generally, when they're asking you for complications, still divided into early and late complication. For the early complication of perineal tear, for the early complication of perineal tear, we are going to have things like hemorrhage. Is it clear? We are going to have things like pain. Is it clear? You are going to have things like hemorrhage, you have things like pain, and you have things like infections. Is it clear? Occurring at that level. You have hemorrhage, you have pain, infection. And then for the late complication of perineal tear, if the pain is chronic, you have dyspareunia. Is it clear? That's pain during sexual intercourse. And you need to know that dyspareunia is divided into 3. We have superficial dyspareunia, we have mid dyspareunia, and we have deep dyspareunia. Is it clear? Superficial dyspareunia usually is as a result of a problem occurring at the level of the perineum. Deep dyspareunia is usually a problem occurring at the level of the cervix. And when you have mid dyspareunia, it's usually an association of superficial and deep dyspareunia etiologies. So this patient is usually going to have a superficial and a mid dyspareunia disorder. So when the male want to penetrate into the vagina, is at that time that she feels pain. The second one, we can have healing disorders. Is it clear? Healing disorders. And what are some healing disorders you can have? You can have fistulas. Is it clear? You can have fistulas. You can have sinuses. Is it clear? You can have sinuses. You can have fibrosis that can occur at that level. And then we have also abscess formation. Is it clear? So those are the different healing disorders the patient can have at the level due to late disorders. Is it clear? And you have also a pelvic instability, a perineal instability. So those are the different things that you can have at the level as complication of perineal tear. Is it clear? So now the next thing that you need to visualize, after visualizing now the second stage of labor and its management, we're now going to visualize the third stage of labor and its management.